Yalla. So we'll talk today about carpal tunnel syndrome. So usually carpal tunnel syndrome is the most common compressive neuropathy that happens that happens in the hand. You will see lots of patients that they present with a carpal tunnel, but the most important thing when people present with a carpal tunnel is making sure that they have the right diagnosis. The carpal tunnel is an area where a lot of vital structures they pass. So we'll have introduction to the anatomy. So there are 10 structures that goes through the carpal tunnel. You have the 4 tendon of the flexor digitorum superficialis, 4 tendon of the flexor digitorum profundus, and the median nerve, and the flexor pollicis longus. In a very rare cases, you may have the median nerve comes with a median artery. All of these, they pass through a very small tunnel that makes the floor is made by the carpus bone, and the roof is by the fibrous ligament, which is the transverse flexor ligament. So when we go here, this is the surface anatomy. The picture probably is not as good. So when you can see the flexor carporadialis tendon with the palmaris longus, in between them you will find the median nerve. The median nerve is responsible for the function of different hand muscle in the hand, the intrinsic muscles, which called the loaf muscles, which is the lumbricals of the first and the second, the opponent's pollicis, and the first and second profundus, and the superficial head of the flexor pollicis. The steroid injection can be one of the non-surgical tool that we do and use when we treat carpal tunnel syndrome. First, you have to do non-steroid, non-surgical approach. You start with the splinting and night splinting, and usually they have that night splinting because when we sleep, we have the tendency to flex our arms, and once we have that flexion, that will compress the tunnel and it will provoke the symptoms all over again. So we start with the splinting at night. If it doesn't improve, we will have to go to steroid injection because it will reduce that edema. And then if it's not, we will go for the surgical options. For the surgical options, we will go